Now we're going to move and look at the movements of the pectoral girdle and in particular the scapulothoracic joint. So it's basically our scapula moving on our thorax, and we have something called the scapulohumeral rhythm. So every time we do glenohumeral motion of ABA adduction, flexion extension, medial or lateral rotation, our scapula moves as well. And so this is just the motion of the scapula, but they are overlaid and in combination with movements of the humerus, which allows us to have a really large range of motion in our upper body. So frontal plane rotation, if you will, is called upward and downward rotation of the scapula. So if you abduct your glenohumeral joint, your scapula will rotate up, so your humerus is still in line with the glenoid fossa of the scapula. And in a drawing, the gray is the original position of our scapula. Red is upward rotation and blue is downward rotation. So this we rotate up, and for the blue we rotate down. The point of reference for this type of rotation is the glenoid fossa. So if the glenoid fossa points up or starts to rotate up, it is upward rotation. If the glenoid fossa is pointing downward, it is downward rotation. We also have frontal plane translation, elevation, so your scapula moving up like this, and depression. And again, that's kind of like shrugging your shoulders or your shoulder complex. In a drawing, again, gray is neutral, elevation is in pink, you're moving your scapula up, or green, you are depressing or moving your scapula down. In the transverse plane, the scapula are either abducting or adducting. And remember, the definition of AB and adduction, AB is away from the midline, adduction is towards the midline. So we need to know where our midline is. The midline for scapula, AB, and adduction is our spinous processes. So midline on our spine, abduction is when the scapula are moving away from the midline. So you're kind of rounding your shoulders, if you will. And if you try to pinch your scapula together, that is adduction of the scapula. So abduction, they're moving away, adduction, they're moving towards. Another way to say abduction, some people use the term protraction, and for adduction, they call it retraction. And so wherever you move on in your education, people may use these terms either interchangeably or they could even have different definitions for protraction and retraction. So on our diagrams, again, gray is neutral. Abduction or protraction away from the midline is in green. And remember, our midline is straight down the center. And then adduction or retraction is towards that midline. And here's just a nice illustration of all of the motions. So elevation, depression, upward rotation, downward rotation, AB, and adduction.